Imagine this. You're at your annual checkup, feeling healthy and strong. You lead an active life, eat well, and haven't experienced any alarming symptoms. Then, your doctor tells you they found something, uterine fibroids. You've never heard of them, but suddenly, this invisible condition has taken center stage. It can be a lot to process, especially when something so common is rarely talked about. We're here to change that. This scenario plays out in doctors' offices worldwide every single day. Uterine fibroids are frequently considered a silent condition. This is partly because many women with fibroids don't experience any noticeable symptoms. They may go years, even decades, without realizing these growths are present in their bodies. This silence, however, can be deceptive. Even in the absence of obvious signs, fibroids can silently impact a woman's life. They can grow large, causing discomfort and bloating. They can impact fertility, making it difficult to conceive. And in some cases, they can lead to heavy menstrual bleeding, anemia, and a host of other complications. The unseen nature of uterine fibroids makes open conversations about them even more crucial. By breaking the silence, we can empower women to be proactive about their health, seek early diagnosis, and explore the wide range of treatment options available to them. Don't let the word tumor alarm you. While it's true that fibroids are technically classified as tumors, it's essential to remember that they are benign, meaning they are not cancerous. This distinction is crucial because it significantly influences how we approach diagnosis, treatment, and overall management of the condition. Understanding the basic biology of uterine fibroids is the first step toward demystifying them. It allows us to move beyond fear and approach the topic with knowledge and a sense of empowerment. Uterine fibroids are incredibly common, affecting millions of women worldwide. In fact, studies suggest that up to 70% of women will develop fibroids by the age of 50. This prevalence is staggering, highlighting the widespread nature of this often overlooked condition. Despite their prevalence, many women remain unaware of uterine fibroids until they experience symptoms or receive a diagnosis. This lack of awareness can be attributed to various factors, including the often subtle nature of the condition, cultural taboos surrounding women's health, and limited public health campaigns dedicated to raising awareness. This silent epidemic underscores the urgent need for greater education, open dialogue, and increased access to healthcare resources for women. By shining a light on this common condition, we can empower women to take charge of their reproductive health and seek timely medical care when needed. We've established that uterine fibroids are non-cancerous growths, but what exactly are they made of? Imagine a tight knot of muscle fibers and connective tissues intertwined within the wall of the uterus. That's essentially what a fibroid is, a benign tumor composed of these elements. These growths aren't just random clumps of cells, they have a distinct structure. Picture a fibroid as having a central core, often denser and more fibrous. This core is surrounded by layers of smooth muscle cells, similar to those found in the uterine wall itself. Understanding the composition of fibroids helps us grasp how they develop and behave within the uterine environment. It also lays the groundwork for understanding why certain treatments target specific aspects of their makeup. The exact cause of uterine fibroids remains somewhat of a medical mystery. While researchers have identified several factors that likely contribute to their development, a single definitive cause has yet to be pinpointed. This can make it challenging to pinpoint why some women develop fibroids while others don't. However, this doesn't mean we're completely in the dark. Scientists believe that fibroids likely arise from a complex interplay of genetic predisposition, hormonal influences, and possibly environmental factors. Think of it as a puzzle with multiple pieces, each contributing to the overall picture. Unraveling the mysteries of fibroid development is an area of ongoing research. As scientists delve deeper into the intricate mechanisms involved, we can hope for more targeted prevention and treatment strategies in the future. Just like houses in a neighborhood, uterine fibroids come in different shapes, sizes, and most importantly, locations. The location of a fibroid within the uterus plays a significant role in determining the symptoms a woman might experience and the type of treatment that might be recommended. Imagine the wall of the uterus as a multi-layered structure. Fibroids can develop within any of these layers, each location giving them a specific name and set of characteristics. Understanding these different types is crucial for effective diagnosis and treatment planning. In the following sections, we'll explore each type of fibroid in more detail, shedding light on how their location influences their potential impact on a woman's health and well-being. Intramural fibroids, as their name suggests, are found within the muscular wall, or myometrium, of the uterus. Think of them as residing within the walls of the uterine house, sometimes barely noticeable, other times expanding and causing the walls to bulge outward. These are the most common type of fibroids, often developing during a woman's reproductive years. While some intramural fibroids remain small and asymptomatic, others can grow quite large, putting pressure on surrounding organs and causing a range of symptoms. The size and location of intramural fibroids within the uterine wall can influence whether or not they cause symptoms. Some women with these fibroids may experience heavy menstrual bleeding, pelvic pain, or a feeling of pressure in the lower abdomen. Subserosal fibroids develop on the outer surface of the uterus, growing outward into the pelvic cavity. Imagine them as bumps on the exterior of the uterine house, sometimes barely noticeable, other times protruding significantly. These fibroids can vary greatly in size. Some remain small and asymptomatic, while others can grow quite large, potentially pressing on nearby organs like the bladder or rectum. This pressure can lead to symptoms such as frequent urination, constipation, or lower back pain. In some cases, subserosal fibroids develop a thin stalk that connects them to the uterus. These are known as pedunculated fibroids and can sometimes twist, causing intense pain. Submucosal fibroids grow from the inner lining of the uterus, the endometrium, and protrude into the uterine cavity. Imagine them as growths projecting inward, potentially distorting the shape of the uterine room. These fibroids, though less common than intramural or subserosal types, can cause significant symptoms, especially if they grow large. Their location within the uterine cavity often leads to heavy menstrual bleeding, prolonged periods, and even fertility issues. Submucosal fibroids can interfere with the normal shedding of the uterine lining during menstruation, leading to heavier bleeding. They can also make it difficult for a fertilized egg to implant, potentially contributing to infertility. Pedunculated fibroids are a unique subtype that can occur with both subserosal and submucosal fibroids. These fibroids develop a stalk, or pedicle, that connects them to the uterine wall. Imagine a mushroom growing from the ground. The fibroid is the cap, and the stalk is the pedicle. This stalk can sometimes twist, cutting off the blood supply to the fibroid. This is known as torsion and can cause sudden, severe pain. While pedunculated fibroids can occur with both subserosal and submucosal types, they are more common with subserosal fibroids. The symptoms they cause can vary depending on their size, location, and whether or not torsion occurs. The exact mechanisms that trigger the growth of uterine fibroids are still being unraveled. However, research suggests that certain factors play a significant role in their development, including genetics, hormones, and possibly even environmental influences. Imagine these factors as interconnected threads, each contributing to the complex tapestry of fibroid growth. While we may not fully understand how all the threads weave together, we're beginning to identify the key players involved. By understanding the factors that influence fibroid growth, we can better grasp why some women develop these growths while others don't, and work towards developing more targeted prevention and treatment strategies. Genetics appear to play a significant role in fibroid development. Women with a family history of fibroids, particularly mothers or sisters who have had them, are at increased risk. This suggests that certain genes may make some women more susceptible to these growths. Hormones, specifically estrogen and progesterone, are also thought to be key players in fibroid growth. These hormones, essential for regulating the menstrual cycle and pregnancy, can also stimulate the growth of fibroid tissue. This hormonal link is further supported by the observation that fibroids tend to grow more rapidly during the reproductive years when estrogen and progesterone levels are higher and often shrink after menopause when these hormone levels decline. Estrogen and progesterone, the two main female sex hormones, play a crucial role in the menstrual cycle and pregnancy. While essential for reproductive health, these hormones also appear to influence fibroid growth, creating a delicate balance. Think of estrogen and progesterone as two sides of a seesaw. When in balance, they help regulate the menstrual cycle and support a healthy uterine environment. However, imbalances in these hormones, particularly elevated levels of estrogen, can tip the scales in favor of fibroid growth. Research suggests that fibroids have more estrogen and progesterone receptors than normal uterine tissue, making them more sensitive to the growth-promoting effects of these hormones. While genetics and hormones are considered primary drivers of fibroid growth, researchers are also exploring other potential contributing factors, including diet, lifestyle, and environmental exposures. These factors may not directly cause fibroids but could influence their development in susceptible individuals. For instance, some studies suggest that diets high in red meat and low in fruits and vegetables may be associated with an increased risk of fibroids. Conversely, diets rich in antioxidants and fiber may have a protective effect. Other factors under investigation include exposure to certain environmental toxins, such as pesticides and industrial chemicals, as well as lifestyle factors like stress and lack of physical activity. Uterine fibroids are remarkably common, affecting millions of women worldwide. While the exact prevalence varies depending on factors like age, race, and ethnicity, studies suggest that a significant proportion of women will develop fibroids at some point in their lives. The prevalence of fibroids is particularly high among African American women, who are 2 to 3 times more likely to develop these growths than women of other racial and ethnic backgrounds. The reasons for this disparity are not fully understood but likely involve a complex interplay of genetic, hormonal, and environmental factors. Understanding the prevalence patterns of uterine fibroids is crucial for raising awareness, promoting early detection, and addressing health disparities in fibroid diagnosis and treatment. Uterine fibroids are often described as a silent condition because many women experience no noticeable symptoms. However, for those who do, the symptoms can range from subtle and easily overlooked to severe and debilitating, impacting various aspects of their lives. Imagine a symphony orchestra. Some instruments play softly in the background, barely noticeable, while others command attention with their powerful melodies. Similarly, fibroid symptoms can manifest in a wide range of ways, varying in intensity and duration from woman to woman. Understanding the diverse range of fibroid symptoms is crucial for early detection and timely intervention. This knowledge empowers women to advocate for their health, seek appropriate medical care, and explore the full spectrum of treatment options available to them. One of the most common and often distressing symptoms of uterine fibroids is heavy menstrual bleeding, also known as menorrhagia, and potentially leading to other health complications. Imagine having to change your sanitary protection every hour or two, fearing embarrassing leaks, or being unable to participate in activities you enjoy due to heavy bleeding. For many women with fibroids, these scenarios are a monthly reality, causing significant distress and impacting their quality of life. Heavy menstrual bleeding can also lead to iron deficiency anemia, a condition that causes fatigue, weakness, and shortness of breath. While some degree of cramping during menstruation is normal, women with uterine fibroids often experience significantly more intense and debilitating period pain, known as dysmenorrhea. This pain can be sharp, stabbing, or aching, radiating to the lower back and legs, making it difficult to perform everyday tasks. Imagine the feeling of intense menstrual cramps that make it difficult to stand up straight, concentrate at work, or engage in social activities. For many women with fibroids, this pain becomes a regular part of their menstrual cycle, impacting their productivity, emotional well-being, and overall quality of life. The pain associated with fibroids during menstruation can be attributed to several factors, including the increased production of prostaglandins, hormone-like substances that cause the uterus to contract, and the physical pressure of fibroids on surrounding organs. Beyond menstrual cramps, uterine fibroids can cause chronic pelvic pain and pressure, a constant or intermittent discomfort in the lower abdomen that can range from a dull ache to a sharp stabbing sensation. This discomfort can be particularly bothersome during intercourse, bowel movements, or even when simply sitting or standing for extended periods. Imagine a feeling of fullness or heaviness in your lower abdomen, as if you're carrying around a bowling ball. This persistent pressure can make it uncomfortable to wear tight clothing, engage in physical activities, or even find a comfortable sleeping position. The pelvic pain and pressure associated with fibroids are often caused by the physical pressure of these growths on surrounding organs, such as the bladder, rectum, or nerves in the pelvic area. Uterine fibroids can sometimes impact a woman's fertility, making it difficult to conceive naturally. While not all fibroids affect fertility, those that distort the uterine cavity, block fallopian tubes, or interfere with implantation can pose challenges for women trying to become pregnant. Imagine the emotional toll of longing to start a family but facing obstacles due to fibroids. For many women, the journey to parenthood can be fraught with anxiety and uncertainty, and the presence of fibroids can add another layer of complexity. The good news is that many women with fibroids can still conceive and carry healthy pregnancies. However, it's essential to discuss fertility concerns with a healthcare provider to determine if fibroids might be a contributing factor and explore appropriate management options. Pregnancy and uterine fibroids can coexist, but this combination can sometimes lead to complications for both the mother and the developing baby. The hormonal changes of pregnancy can cause existing fibroids to grow, potentially increasing the risk of certain pregnancy-related issues. Imagine the joy of pregnancy mixed with the uncertainty of how fibroids might impact the journey ahead. For many women, this can be a time of heightened anxiety, requiring careful monitoring and open communication with healthcare providers. While most women with fibroids have healthy pregnancies and deliveries, these growths can increase the risk of complications such as preterm labor, miscarriage, fetal growth restriction, or placental abruption. Depending on their size and location, uterine fibroids can press on neighboring organs in the pelvis, leading to bladder and bowel problems. Fibroids that push against the bladder can cause urinary frequency, urgency, or incontinence, while those that press on the rectum can lead to constipation, pain during bowel movements, or a feeling of incomplete evacuation. Imagine the discomfort and inconvenience of constantly needing to urinate, feeling like you can't fully empty your bladder. These symptoms can significantly impact a woman's quality of life, making it challenging to engage in everyday activities. If you're experiencing bladder or bowel issues, it's essential to consult a healthcare provider to determine the underlying cause and explore appropriate treatment options. Heavy menstrual bleeding, a common symptom of uterine fibroids, can lead to iron deficiency anemia, a condition that develops when the body lacks sufficient iron to produce red blood cells, which carry oxygen throughout the body. This can result in a cascade of symptoms that affect energy levels, cognitive function, and overall well-being. Imagine feeling constantly fatigued, even after a good night's sleep, struggling to concentrate at work, or experiencing shortness of breath after minimal exertion. These are just a few ways iron deficiency anemia can manifest, impacting a woman's ability to function at her best. If you're experiencing heavy periods and symptoms of anemia, it's crucial to consult a healthcare provider to determine the underlying cause and discuss treatment options. which may include iron supplements or addressing the fibroids themselves. The physical symptoms of uterine fibroids can have a profound impact on a woman's emotional and social well-being. Chronic pain, heavy bleeding, and reproductive challenges can take a toll on self-esteem, relationships, and overall quality of life, leading to feelings of isolation, frustration, and despair. Imagine the emotional roller coaster of dealing with unpredictable heavy periods, missing social events due to pain or fear of embarrassment, or facing uncertainty about fertility. These experiences can be isolating and emotionally draining, impacting a woman's sense of self-worth and her ability to connect with others. It's essential to remember that you're not alone. Seeking support from loved ones, joining support groups, or talking to a therapist can provide invaluable emotional support and coping strategies. While some women experience a symphony of symptoms due to uterine fibroids, others may have no noticeable signs at all, living with these growths silently present in their bodies. This lack of symptoms can make it challenging to detect fibroids early on, potentially delaying diagnosis and treatment until the growths have caused other health issues. Imagine having fibroids that remain hidden, like silent passengers on a long journey, only to reveal themselves later, potentially causing complications or impacting fertility when it's least expected. This uncertainty can be unsettling, highlighting the importance of regular gynecological checkups and open communication with healthcare providers. Even if you're not experiencing any symptoms, regular pelvic exams and discussions with your doctor about your family history and any potential risk factors can help ensure early detection and timely management of uterine fibroids. In the journey of understanding and managing uterine fibroids, one of the most crucial aspects is learning to listen to your body's signals. Our bodies communicate with us constantly, sending subtle cues and sometimes more overt messages when something isn't quite right. Paying attention to these signals, even if they seem minor, can be key to early detection and intervention. Imagine your body as a complex and intricate tapestry, each thread representing a different system and function. When one thread is pulled or out of place, it can create a ripple effect throughout the entire tapestry. Similarly, even seemingly small changes in your menstrual cycle, pelvic area, or overall well-being can be significant. Don't dismiss unusual bleeding patterns, persistent pain, or changes in your body as normal. Trust your instincts, and if something feels off, don't hesitate to seek guidance from a healthcare professional. Recognizing when to consult a healthcare provider about potential uterine fibroids is crucial for timely diagnosis and management. While not all menstrual irregularities or pelvic discomfort indicate fibroids, it's essential to seek professional guidance to rule out other conditions and discuss any concerns you may have. Imagine your health as a garden that requires nurturing and attention. Just as you wouldn't ignore signs of pests or disease in your garden, you shouldn't hesitate to seek expert advice when it comes to your body. Early detection and intervention often lead to better outcomes and a wider range of treatment options. If you experience heavy menstrual bleeding, severe pelvic pain, prolonged periods, or any other concerning symptoms, schedule an appointment with your doctor or gynecologist to discuss your concerns and determine the best course of action. Early detection and diagnosis of uterine fibroids are paramount for effective management and improving a woman's quality of life. By recognizing the early signs and symptoms, seeking timely medical attention, and undergoing appropriate diagnostic tests, women can empower themselves to make informed decisions about their health and explore the full range of treatment options available to them. Imagine a ship navigating through a narrow passage. Early detection is like having a skilled navigator on board, charting the course and making adjustments as needed to ensure a safe and successful journey. Similarly, early diagnosis allows healthcare providers to create personalized treatment plans tailored to each woman's individual needs and circumstances. The journey of unraveling uterine fibroids begins with awareness, knowledge, and a proactive approach to one's health. The treatment landscape for uterine fibroids has evolved significantly in recent years, offering women a wider range of options than ever before. From watchful waiting to medications, minimally invasive procedures, and surgery, the best approach is often a personalized one, tailored to each woman's individual needs and circumstances. Imagine a toolbox filled with various tools, each designed for a specific purpose. Similarly, healthcare providers now have a diverse array of treatment modalities at their disposal, allowing them to select the most appropriate tools to address each woman's unique fibroid situation. The decision of which treatment path to pursue depends on several factors, including the size, location, and number of fibroids, the severity of symptoms, the woman's age, desire for future fertility, and overall health status, and her personal preferences and values. For some women with uterine fibroids, especially those experiencing mild or no symptoms, watchful waiting may be an appropriate initial approach. This involves monitoring the fibroids over time with regular pelvic exams, ultrasounds, or other imaging tests to track their size and any changes in symptoms. Imagine a gardener tending to a flower bed, observing the plants closely for signs of growth, pests, or disease before taking any action. Similarly, watchful waiting allows healthcare providers to monitor fibroids without immediate intervention, intervening only if the growths cause symptoms or raise other health concerns. Watchful waiting is often recommended for women approaching menopause, as fibroids tend to shrink after estrogen levels decline. It's also a reasonable option for women with small asymptomatic fibroids that are not expected to cause problems. Medications can play a role in managing uterine fibroid symptoms and, in some cases, shrinking the fibroids themselves. These medications work through various mechanisms, targeting the hormones that influence fibroid growth or addressing specific symptoms such as heavy bleeding or pain. Imagine a conductor fine-tuning the instruments of an orchestra, adjusting the volume and tone to create a harmonious sound. Similarly, medications can help modulate the body's hormonal environment or target specific symptoms to provide relief and improve a woman's quality of life. Medications for uterine fibroids can be broadly categorized into two main types: hormonal therapies and non-hormonal medications. Hormonal therapies for uterine fibroids aim to regulate the levels of estrogen and progesterone, the two hormones that play a key role in fibroid growth. By modulating these hormone levels, these therapies can help shrink fibroids, reduce heavy bleeding, and alleviate other symptoms. Imagine a seesaw with estrogen and progesterone on opposite sides. Hormonal therapies work by adjusting the weight on each side, bringing the seesaw into a more balanced position and reducing the stimulatory effects of these hormones on fibroid growth. Several types of hormonal therapies are available, including gonadotropin-releasing hormone, GnRH agonists, progestin-releasing intrauterine devices, IUDs, and birth control pills. The choice of which therapy is most appropriate depends on the individual woman's circumstances, including her age, desire for future fertility, and the severity of her symptoms. While hormonal therapies address the hormonal underpinnings of uterine fibroids, non-hormonal medications focus on managing specific symptoms, such as heavy menstrual bleeding or pain, without directly affecting the fibroids themselves. Imagine a toolkit with various tools, each designed to address a specific problem. Non-hormonal medications for fibroids are like specialized tools, targeting particular symptoms to provide relief and improve a woman's quality of life without altering the fibroids themselves. Non-hormonal options for managing fibroid symptoms include pain relievers such as ibuprofen or naproxen to alleviate menstrual cramps and iron supplements to treat iron deficiency anemia caused by excessive menstrual blood loss. For women seeking more definitive treatment for uterine fibroids without the risks and recovery time associated with traditional surgery, minimally invasive procedures offer a compelling alternative. These procedures are typically performed on an outpatient basis, using small incisions, specialized instruments, and imaging guidance to access and treat the fibroids. Imagine a skilled artisan using precision tools to repair a delicate piece of art, minimizing damage and preserving the integrity of the artwork. Similarly, minimally invasive procedures allow surgeons to target fibroids with remarkable accuracy, minimizing trauma to surrounding tissues and promoting faster recovery. Several minimally invasive procedures are available for treating uterine fibroids, each with its own set of benefits, risks, and considerations. Some of the most common minimally invasive options include uterine artery embolization, myomectomy, radiofrequency ablation, and high-intensity focused ultrasound, HIFU. Uterine artery embolization, UAE, is a minimally invasive procedure that blocks the blood supply to uterine fibroids, causing them to shrink and die. This procedure is performed by an interventional radiologist who inserts a thin catheter into an artery in the groin or wrist and guides it to the uterine arteries. Imagine a gardener cutting off the water supply to a weed, causing it to wither and die. Similarly, UAE deprives fibroids of the blood and nutrients they need to survive, leading to their shrinkage and symptom relief. During UAE, tiny particles are injected through the catheter into the uterine arteries, blocking the blood flow to the fibroids. As the fibroids shrink, their symptoms, such as heavy bleeding, pelvic pain, and pressure, gradually improve. Myomectomy is a surgical procedure that removes uterine fibroids while leaving the uterus intact. This procedure is often the preferred option for women who wish to preserve their fertility or who want to avoid a hysterectomy. Similarly, myomectomy allows surgeons to remove fibroids with precision, sparing the uterus and maintaining its ability to function normally. Myomectomy can be performed using various techniques, including abdominal myomectomy, which involves a larger incision in the abdomen, laparoscopic myomectomy, which uses small incisions and specisions. This procedure is performed using a slender needle that delivers radiofrequency energy directly into the fibroid, heating and destroying the fibroid tissue. Imagine a chef using a precise flame to cauterize a piece of meat, sealing in its juices and preventing blood loss. Similarly, RFA uses controlled heat to ablate fibroids, damaging the cells and causing the fibroids to shrink over time. RFA is typically performed on an outpatient basis using local anesthesia and mild sedation. High-intensity focused ultrasound, or HIFU, is a non-invasive procedure that uses focused ultrasound waves to heat and destroy uterine fibroids. This innovative treatment modality delivers precise beams of ultrasound energy to the fibroids, raising their temperature and causing cellular death without harming surrounding tissues. Imagine a magnifying glass focusing sunlight onto a single point, creating intense heat. Similarly, HIFU concentrates ultrasound waves onto the fibroids, generating heat that ablates the fibroid tissue while sparing the surrounding healthy uterine tissue. HIFU is a relatively new treatment option for uterine fibroids, but it has shown promising results in clinical trials and is becoming increasingly available. It's a non-invasive procedure, meaning it doesn't involve any incisions or cuts, and most women recover quickly with minimal discomfort. While minimally invasive procedures have revolutionized the treatment of uterine fibroids, surgery remains a viable option in certain cases, particularly when the fibroids are large, numerous, or causing severe symptoms that haven't responded to other treatments. Surgery allows surgeons to address complex fibroid cases, removing the growths and reconstructing the uterus as needed to preserve fertility or alleviate symptoms. The most common surgical procedure for uterine fibroids is a hysterectomy, which involves removing the after exploring all other treatment options for uterine fibroids. While hysterectomy is highly effective in eliminating fibroids and preventing their recurrence, it's a permanent procedure that results in the loss of fertility and brings about menopause if the ovaries are also removed. Imagine a tree being felled in a forest, its presence gone forever. Similarly, hysterectomy removes the uterus, ending the possibility of future pregnancies and marking a significant life transition for many women. Hysterectomy is typically reserved for women with large, symptomatic fibroids that haven't responded to other treatments, or for those who have completed their families and are experiencing severe fibroid-related symptoms. It's essential to have a thorough discussion with your doctor about the risks and benefits of hysterectomy, as well as the emotional and physical implications of this life-altering procedure. The field of uterine fibroid treatment is constantly evolving, with researchers exploring new frontiers in both conventional and alternative therapies. From novel medications to innovative surgical techniques and promising natural remedies, the future holds exciting possibilities for women seeking to manage this common condition. Imagine a team of explorers venturing into uncharted territory, seeking new discoveries and charting new paths. Similarly, researchers are continuously investigating new ways to prevent, diagnose, and treat uterine fibroids, aiming to improve women's lives and expand their treatment options. Emerging research areas include the development of targeted therapies that specifically disrupt the growth of fibroids without affecting healthy tissues, as well as investigations into the role of diet, lifestyle, and environmental factors in fibroid development and progression. Navigating the world of uterine fibroids can feel overwhelming, but remember that knowledge is power. By arming yourself with information, understanding your options, and engaging in open communication with your healthcare provider, you can make informed decisions about your body and take charge of your health. Imagine yourself as the captain of your own ship, charting your course and making decisions that align with your values and goals. Similarly, you are the ultimate decision maker when it comes to your health. Your healthcare provider is your trusted navigator, providing guidance and support along the way. Don't hesitate to ask questions, seek second opinions if needed, and advocate for your needs and preferences. Remember that you are not alone in this journey, and there are resources available to support you every step of the way. Uterine fibroids, like many health conditions shrouded in mystery, have become entangled with a web of myths and misconceptions. These myths, often passed down through generations or perpetuated by misinformation, can create unnecessary anxiety, influence treatment decisions, and prevent women from seeking timely medical care. Imagine a detective carefully sifting through evidence, separating fact from fiction to solve a case. Similarly, it's time to shine a light on the truth about uterine fibroids, dispelling the myths that have clouded our understanding of this common condition. By separating fact from fiction, we can empower women to approach their health with clarity, make informed decisions about their bodies, and advocate for the care they deserve. One of the most pervasive myths surrounding uterine fibroids is that all fibroids cause painful symptoms. This misconception likely stems from the fact that pain and heavy bleeding are among the most noticeable and concerning symptoms associated with these growths. However, it's crucial to remember that many women with fibroids experience no symptoms at all. Imagine a garden filled with different types of plants, some with vibrant flowers and others with subtle foliage. Similarly, uterine fibroids can manifest in various ways, with some causing noticeable symptoms and others remaining silent and undetected for years. While some women with fibroids experience debilitating pain, heavy bleeding, or other distressing symptoms, many others live with these growths completely unaware of their presence. The size, location, and number of fibroids, as well as individual variations in pain perception, all contribute to whether or not a woman experiences symptoms. Another common misconception about uterine fibroids is that they always grow rapidly, quickly becoming large and problematic. While it's true that some fibroids can grow quickly, especially during pregnancy when hormone levels are elevated, many fibroids grow slowly over time or remain relatively stable in size. Imagine a time-lapse video of a garden, with some plants shooting up quickly while others grow at a more gradual pace. Similarly, the growth patterns of uterine fibroids can vary significantly, with some expanding rapidly, others growing slowly, and some remaining relatively unchanged over time. The growth rate of fibroids is influenced by several factors, including a woman's age, hormone levels, genetics, and overall health status. Regular monitoring by a healthcare provider can help track the growth of fibroids and guide treatment decisions if needed. Perhaps one of the most disheartening myths surrounding uterine fibroids is the belief that they automatically equate to infertility, robbing women of their dream of motherhood. While it's true that fibroids can sometimes impact fertility, it's crucial to remember that many women with fibroids conceive and carry healthy pregnancies without any complications. Imagine a bridge with several lanes, some open and flowing smoothly, while others may have obstacles or detours. Similarly, fibroids can sometimes create roadblocks on the path to parenthood, but they don't necessarily signify a dead end. The location and size of fibroids play a significant role in their potential impact on fertility. Fibroids that distort the uterine cavity, block fallopian tubes, or interfere with implantation are more likely to cause challenges, while those located in other areas of the uterus may have no impact on conception or pregnancy. The misconception that hysterectomy, the surgical removal of the uterus, is the only solution for uterine fibroids is a myth that has caused unnecessary fear and anxiety for countless women. While hysterectomy is undoubtedly an effective treatment option for some women with fibroids, it's far from the only solution, and in many cases, less invasive and fertility-preserving options are available. Imagine a toolbox filled with a variety of tools, each designed for a specific purpose. Similarly, the treatment landscape for uterine fibroids offers a diverse array of options, with hysterectomy being just one tool in the toolbox. Minimally invasive procedures, medications, and even watchful waiting can be effective in managing fibroids and alleviating symptoms, allowing women to preserve their fertility and avoid major surgery. The best treatment approach is always a personalized one, tailored to each woman's individual needs and circumstances. The fear of recurrence is a common concern among women who have undergone treatment for uterine fibroids. However, the myth that fibroids always return after treatment, haunting women with the specter of endless procedures, is simply not true. While fibroids can recur, the likelihood of recurrence varies depending on the type of treatment received and individual factors. Imagine a garden that has been weeded, with some weeds more persistent than others. Similarly, while some fibroids may reappear after treatment, others are effectively eradicated, and the risk of recurrence can be minimized with appropriate management strategies. The likelihood of fibroid recurrence is influenced by factors such as the type of fibroids, the woman's age, hormone levels, and overall health. Following a healthy lifestyle, managing stress, and maintaining a healthy weight can also play a role in reducing the risk of recurrence. The idea that you can shrink uterine fibroids with diet alone is a tempting one, promising a natural and effortless solution to a complex medical condition. While it's true that a healthy diet plays a vital role in overall health and well-being, and certain dietary modifications may support hormonal balance, there is no scientific evidence to suggest that diet alone can shrink existing fibroids. Imagine a house with a leaky roof. While patching the roof may temporarily stop the leaks, it won't address the underlying structural issues. Similarly, while dietary changes may support hormonal health and potentially slow fibroid growth, they cannot magically erase existing fibroids. While diet alone cannot shrink fibroids, adopting a healthy eating plan rich in fruits, vegetables, whole grains, and lean protein can support overall health, manage weight, and promote hormonal balance, potentially influencing fibroid growth patterns. The diagnosis of uterine fibroids can be daunting, often leading to the assumption that all women with these growths require immediate treatment. However, this is a misconception that fails to consider the often individualized nature of fibroids and the variety of factors that influence treatment decisions. Imagine a doctor's office with patients waiting to be seen, each with their own unique health history and concerns. Similarly, the approach to managing uterine fibroids is not a one-size-fits-all approach, but rather a personalized journey guided by the specific characteristics of the fibroids, the woman's symptoms, and her individual preferences. The decision of whether or not to treat uterine fibroids depends on several factors, including the size, location, and number of fibroids, the severity of symptoms, the woman's age, desire for future fertility, and overall health status, and her personal values and preferences. The fear of cancer is a powerful one, and the misconception that uterine fibroids increase the risk of developing uterine cancer is a myth that has caused undue anxiety for many women. It's crucial to understand that fibroids are benign growths, meaning they are not cancerous, and their presence does not increase the risk of developing uterine cancer. Imagine two separate paths diverging in a forest, each leading to a different destination. Similarly, uterine fibroids and uterine cancer are distinct conditions with separate causes, risk factors, and treatment approaches. While fibroids themselves do not increase the risk of uterine cancer, it's essential to be aware of the signs and symptoms of both conditions and seek prompt medical attention if you experience any unusual bleeding, pelvic pain, or other concerning symptoms. The idea that uterine fibroids are contagious, spreading from person to person like a common cold, is a myth that has no basis in scientific fact. Fibroids are not caused by an infectious agent and cannot be transmitted through physical contact, sexual intercourse, or any other means. Imagine a field of dandelions, each plant sprouting independently from its own seed. Similarly, uterine fibroids develop within a woman's body due to a complex interplay of genetic, hormonal, and potentially environmental factors, and their presence in one individual does not pose a risk to others. The development of uterine fibroids is influenced by factors within a woman's own body, and their presence is not a reflection of hygiene, lifestyle choices, or any external factors that could be transmitted to others. The desire to prevent any health condition is understandable, and the hope that we can entirely prevent uterine fibroids is a tempting one. However, the truth is that while we can make lifestyle choices that support overall health and potentially influence fibroid development, there is no guaranteed way to prevent these growths entirely. Imagine a gardener tending to a garden, carefully nurturing the soil, providing adequate sunlight and water, and protecting the plants from pests. While these efforts create an environment conducive to healthy growth, they cannot entirely eliminate the possibility of weeds appearing. While we cannot completely control the complex interplay of genetics, hormones, and environmental factors that contribute to fibroid development, adopting a healthy lifestyle, maintaining a healthy weight, and managing stress may play a role in influencing fibroid growth patterns. In the realm of uterine fibroids, knowledge is power. By dispelling the myths, understanding the facts, and engaging in open communication with your healthcare provider, you can make informed decisions about your body and navigate this common condition with confidence. Imagine yourself standing at a crossroads, equipped with a map and a compass, ready to choose the path that aligns with your values and goals. Similarly, armed with accurate information and a trusted healthcare team by your side, you can confidently navigate the world of uterine fibroid treatment and make choices that support your overall well-being. Remember, you are your own best advocate. Don't hesitate to ask questions, seek second opinions if needed, and voice your concerns. By taking an active role in your health journey, you can empower yourself to make the best decisions for your body and live a full and vibrant life, with or without uterine fibroids. As we conclude our exploration of uterine fibroids, it's essential to remember that knowledge is power, and you have the power to make informed decisions about your body and your health. Armed with a deeper understanding of this common condition, you can advocate for yourself, seek timely medical care, and explore the full range of treatment options available to you. Imagine yourself standing tall, a beacon of strength and resilience, holding the reins of your own health journey. You are not defined by uterine fibroids or any other health challenge you may face. You are a woman of strength, wisdom, and resilience. capable of navigating life's complexities and making choices that align with your values and aspirations. Trust your instincts, listen to your body's whispers, and never hesitate to seek guidance from healthcare professionals who respect your autonomy and empower you to make informed decisions about your well-being. The journey of understanding and managing uterine fibroids is often a journey of self-discovery. It's about tuning into your body's signals, recognizing your individual needs, and advocating for the care you deserve. It's about embracing your strength, honoring your experiences, and connecting with other women who share similar journeys. Imagine yourself embarking on a hike through a beautiful forest. Along the way, you encounter challenges, steep inclines, rocky terrain, perhaps even a detour or two, but you persevere, drawing strength from within, relying on the support of your companions, and celebrating each milestone along the way. The path may not always be easy, but it's your path to forge. Embrace the challenges as opportunities for growth, seek support when you need it, and never underestimate the power of your own resilience. Uterine fibroids, like many health conditions, are best approached holistically, considering not just the physical symptoms but also the emotional, mental, and spiritual aspects of well-being. Nurturing your overall health through a balanced lifestyle, stress management techniques, and a supportive network of loved ones can profoundly impact your experience with fibroids and enhance your overall quality of life. Imagine your body as a garden, teeming with life and potential. Just as a gardener tends to the soil, provides adequate sunlight and water, and protects the plants from pests, nurturing your overall health creates a fertile ground for healing and well-being. Embrace practices that nourish your mind, body, and spirit. Engage in activities that bring you joy, connect with nature, and surround yourself with people who uplift and inspire you. Remember that your health is a precious gift, and taking care of yourself is an act of self-love and empowerment. For too long, uterine fibroids have been shrouded in silence, whispered about in hushed tones, or dismissed as just a woman's problem. It's time to break the silence, to share our stories, and to support each other on this journey. By opening up about our experiences, we can raise awareness, dismantle stigma, and create a community of understanding and empowerment. Imagine a circle of women gathered together, sharing their stories, offering support, and lifting each other up. In these shared spaces, we find strength, validation, and the courage to navigate our health challenges with greater resilience. Reach out to other women, share your story, and listen with an open heart. Together, we can create a chorus of voices, demanding better research, improved treatment options, and greater awareness of this common condition that affects millions of women worldwide. As with many health conditions, early detection and timely intervention can significantly impact the course of uterine fibroids and improve treatment outcomes. By being proactive about your health, attending regular gynecological checkups, and seeking prompt medical attention. If you experience any unusual symptoms, you can empower yourself to make informed decisions about your body and access the most effective treatment options available. Imagine a ship navigating through a narrow passage. Early detection is like having a skilled navigator on board, charting the course and making adjustments as needed to ensure a safe and successful journey. Similarly, early diagnosis allows healthcare providers to create personalized treatment plans tailored to each woman's individual needs and circumstances. Don't dismiss unusual bleeding patterns, persistent pain, or changes in your body as normal. Trust your instincts, and if something feels off, don't hesitate to seek guidance from a healthcare professional. The world of uterine fibroid treatment can feel like a maze, with a bewildering array of options, each with its own set of benefits, risks, and considerations. Navigating through this maze can be overwhelming, but it's important to take your time and gather as much information as possible. Each treatment option, whether it's medication, surgery, or a less invasive procedure, comes with its own set of pros and cons. Understanding these can help you make an informed decision. The key is to remember that there is no one-size-fits-all approach, and the best treatment plan is one that aligns with your individual needs, preferences, and goals. What works for one person may not be suitable for another, and that's perfectly okay. It's about finding what works best for you, considering your unique circumstances and health profile. Imagine yourself standing at the entrance to a garden with a multitude of paths leading in different directions. Each path represents a different treatment option, and each has its own unique journey and destination. Some paths may seem more appealing at first glance, while others might require more careful consideration. Some paths are wide and well-trodden, while others are narrow and less traveled. The wide paths might represent more conventional treatments that many have tried and tested, while the narrow paths could symbolize newer or less common approaches. Both have their merits and potential drawbacks. The path you choose will depend on your destination, your preferred pace, and the scenery you wish to experience along the way. It's important to consider where you want to end up, how quickly you want to get there, and what kind of journey you want to have. Do you prefer a quick resolution, or are you willing to take a longer route for potentially better outcomes? Work closely with your healthcare provider to understand your options, weigh the risks and benefits of each treatment modality, and choose the path that feels right for you. Your healthcare provider can offer valuable insights and help you navigate the complexities of each option. They can also provide support and reassurance as you make your decision. Remember that you are not alone in this journey, and there are resources available to support you every step of the way. From support groups to educational materials, there are many tools at your disposal to help you feel empowered and informed. Lean on these resources and don't hesitate to reach out for help when you need it. Your journey is unique, and finding the right path is a personal and important process. The field of uterine fibroid research is constantly evolving, offering hope for more effective treatments, less invasive procedures, and a deeper understanding of this complex condition. As scientists continue to unravel the mysteries of fibroid development and progression, the future holds exciting possibilities for improving the lives of millions of women worldwide. Imagine a team of explorers venturing into uncharted territory, seeking new discoveries and charting new paths. Similarly, researchers are continuously investigating new ways to prevent, diagnose, and treat uterine fibroids, aiming to improve women's lives and expand their treatment options. From novel medications to innovative surgical techniques and promising natural remedies, the quest for better fibroid treatments continues. By supporting research efforts, participating in clinical trials, and advocating for increased funding, we can help accelerate the pace of discovery and create a brighter future for women living with uterine fibroids. In the tapestry of life, health is one of the most precious threads, intricately woven into every aspect of our being. When it comes to our health, knowledge is power, and we have the right to be informed, to ask questions, and to make choices that align with our values and aspirations. Imagine yourself as the author of your own health story, penning each chapter with intention, wisdom, and a deep sense of self-compassion. Your health journey is uniquely yours, and you have the power to shape its narrative, to seek guidance from trusted healthcare professionals, and to embrace the transformative potential of knowledge and self-care. As you continue on your health journey, remember that you are not alone. Embrace the power within you, seek support when you need it, and never underestimate your ability to heal, to grow, and to live a life filled with vitality, purpose, and joy. Thanks for watching. Until next time, subscribe for more health